the organizers of this event asked us to speak about how they had heard about how here in Manitoba we have been able to create various partnerships, um, working with federal government, monies, specifically monies that flow through Jordan's Principle, to maximize benefits for First Nations children in our province. And this slide is just up to show some of the many organizations, but is not all of the organizations here in Manitoba who have partnered in various ways with FINIB to run Jordan's Principle funded services to benefit our First Nations children. So that's what we're going to get into in more detail in a bit. Joni, if you could just put up the first slide. I'm going to start today, or the next slide, by giving folks a short overview about our province, and just in case you know, one of our main attractions from a tourist viewpoint would be to go see the polar bears in Churchill. This is also I'm not sure, can people see my cursor? Probably not, hey? Okay, so I won't do the travel log for Churchill then. But I want to just give you a short overview about how things work in Manitoba and some of the challenges that we have, and that'll give us background for getting into some detail about some of the things that we've tried to do to maximize services. So the next slide, Joni. So we are a province as of 2021 of 1.3 million people. And our province is heavily concentrated from a population standpoint in Winnipeg. So as you can see, we have well over half of the people in the province are living in metropolitan Winnipeg. And this ends up becoming an issue in terms of care delivery across the board, but certainly impacts us in terms of pediatric care. In terms of breakout data that I could find for our indigenous population, as of 2016, we had 338,000 in the pediatric age group of children overall, excuse me, and then 61,000 First Nations children in Manitoba. As you will see from the numbers, almost half of those live in what we call the NRHA, which is the Northern Regional Health Authority. So basically all the area that's dark green on the upper part of the map. Then the other roughly half of our First Nations children in Manitoba live in the southern half of the province, with 12,000 of them being in Winnipeg. The other thing that we experience here in Manitoba, next slide, Joni, is that we have the unfortunate situation where Manitoba has nearly the highest rate of child poverty in the country, only surpassed by Nunavut. So 28%, this is again 2016 data, but 28% of our children are living in the below the poverty rate. And so this is, of course, nothing to be proud of, and it impacts our children tremendously. And so not only can it impact all the children that we have here in Manitoba, but it really differentially affects our First Nations kids. And so as you can see from the chart on the right, First Nations children on reserve are more likely than not to be living in poverty, with 65% of our kids living in poverty, and 53% of our First Nations children who are living off reserve are living in poverty. So this obviously speaks to the high needs for this population, and the disempowerment for this population, and sets us up with a challenging situation. Joni, can you just put the next slide up? So the other thing that happens in Manitoba is that we have a heavy concentration of all of our pediatric healthcare services in Winnipeg. And many of the First Nations communities in Manitoba are not easily accessible. So many of the First Nations communities in Manitoba would be fly-in communities. So it takes effort to get into or out of, and expense to get into and out of, and it really affects care. We have two pediatric hubs really in Manitoba. So the blue star, the lower one is meant to be over Winnipeg, but it moved. And that's by far and away where a huge proportion of our pediatric care services in Manitoba are situated, with virtually all of our subspecialty care. Everything actually is based out of Winnipeg. There is a little bit of remote care from a subspecialty perspective, but everything else is situated in Winnipeg. And then we have another hub in the north, which is Thompson. But to put it in perspective, there are basically 4 pediatricians in Thompson, and there's a really high turnover of service there. And then the other thing just relevant to this, where we're going to go with this talk, I will say, is that Manitoba is heavily underserviced with clinical health, with child psychologists. So basically some of the worst rates in the country. So we've got high needs without a lot of service. With that, I'm going to turn it over to Joni to talk a little bit about Jordan's principle.
Thank you, Dr. Lane. I'll skip into the next slide here. So maybe I'll start with a bit of background about Jordan River Anderson and Jordan's principle itself, as I don't want to kind of just assume that everybody is aware of Jordan and his story, and how Jordan's principle is being implemented today. So first, to start with Jordan River Anderson. Jordan was born in 1999. He was a member of Norway House Cree Nation, which is in the northern part of Manitoba. When he was born, he was born here in Winnipeg and had a rare muscular disorder called Feynman-Zeider syndrome, which really affected a lot of his health and medical at that time. Jordan spent a lot of his first 2 years in the hospital, or spent the full 2 years of his life in hospital in Winnipeg to receive the services that he required. When Jordan was 2 years old, it was determined that he was going to be able to leave the facilities and go into a specialized medical foster home that could continue his care, and he could live in the community setting. Unfortunately, because Jordan is a child from the First Nations and was going to be going into a foster care system, there was dispute about who was going to cover the cost of his care once he left the hospital, between the federal government and the provincial government. Because there was the jurisdiction issues of who was going to be responsible for the costs of the medical care he would require from a full-time nurse, medical supplies and equipment. This prevented Jordan from leaving the hospital until those things could be sorted out and taken care of. Sadly, Jordan stayed in the hospital for nearly another 3 years while those disputes continued. And at age 5, he passed away at the Winnipeg Children's Hospital without ever being able to leave or ever live in a home setting. Jordan's story was escalated, and in 2007, after a fight, to bring equality and equity for children like him, and to ensure that situations like this would never happen again, the House of Commons passed Jordan's principle. It's now a legal requirement from the Canadian Human Tribunal, Canadian Human Rights Tribunal, that no First Nations child would ever have to go without the supports and services that they were required. And any disputes between governments would be handled behind the scenes, that the service would be provided by the first level government that was approached, and they would take care of these situations, or take care of that funding issue behind the scenes that wouldn't affect the child, therefore making sure that First Nations children would receive the services that they need without denial or delay. I'm going to give a little bit of context also in the background, before a full presentation about the Manitoba model of Jordan's principle implementation. We're very unique here in Manitoba. Since the full implementation of Jordan's principle in late 2016, right away here in Manitoba, First Nation communities received funding directly from the federal government, from Indigenous Services Canada, to start their own, for lack of a better word right now, I'll say Jordan's Principle program. Jordan's Principle isn't a program, but the way that it is delivered here in Manitoba, it's enabled the First Nations communities to be able to deliver the services at home. It first started out with the focus of First Nations children who had disability needs, medical needs, and over the past couple of years has evolved to include children with other needs. So it doesn't necessarily need to be medical in nature, disability in nature, but looking further at education needs. In the past 2 years, through the Back to Basics model, it has also included other social needs now of children and their families. Through the Manitoba model, all 63 First Nation communities have the funding to adjudicate, make approvals on Jordan's Principle requests, and be able to deliver those directly. They also have funding available to do programming for communities members, including lab-based activities, providing social events for community members, and also bringing in different providers to provide some clinical services as needed. Of these 63 First Nation communities, over this past year, 50 of them have now received funding to also support their off-reserve members. For those communities, some of them have chosen to open up off-reserve offices in places such as Winnipeg, Brandon, Thompson, and other nearby communities, wherever they seem to have like a higher population of their members. There's also been funding that has been provided to our 7 tribal councils. So looking at this map that I have available here, the colored areas are the 7 tribal councils across Manitoba. The tribal councils in the earlier days had more of a focus of providing training and support to the First Nation communities in their geographic areas, but over the past few years now are similar to the First Nations, where they actually adjudicate, approve, and provide direct supports to off-reserve members. Such as ourselves here at Southern Chiefs Organization, we also have the 3 provincial territorial offices, which are the 3 First Nations 3 First Nations kind of political offices that do also have a program service delivery area to them. These would be ourselves again as Southern Chiefs Organization, the Assembly of Manitoba Chiefs, and the Manitoba Keewatin Okanagan, which is located in the north. Kind of looking at this map again, if you're looking at, it's very similar to the regions that Dr. Lane had shown in her maps as well, that from the, I think it's the 53rd parallel and below is the SCO region, while the area above that is MKO. Jordan's principle is also provided through Indigenous services here in Manitoba, so they do still have a role for being another source of supports for children and families. There are some services that they specifically require all requests to go to, such as therapy services like occupational physiotherapy, speech and language, and mental health therapies go through their area, as well as technology requests and some other kind of more complex cases will also go to the regional office for adjudicating. And I imagine that might sound complicated. It can be at times. It takes certainly a lot of effort between all parties to work together because not everybody provides the same services as each other. So I'll talk a little bit about that more as we go along. But to give a little bit more context of the Southern Chiefs organization, again, looking at those past maps there, our PTO serves the 34 Anishinaabe and Dakota nations in the southern region of Manitoba that has over 87,000 citizens. The organization is an independent political organization that protects, preserves, promotes, and enhances First Nations peoples' rights, languages, customs, and traditions. We also, as I mentioned earlier, we have a service delivery arm that houses programs such as the Jordan's Principle area. We have a non-insured health benefits navigator program, a traditional healers program, mobile crisis team, a status card program where we often refer families or children who have not been registered to gain their status, as long as some other areas, including the health transformation area. I'm going to turn off the slides, and Dr. Lane and I will maybe talk a little bit more freely without the slide part on. Okay. So maybe I'll go into talking a bit about the Jordan's Principle partnerships that we've created through the Southern Chiefs organization and in working with the Children's Hospital and the Specialized Services for Children and Youth Center that's also located here in Winnipeg. In 2018, we had really identified through our program that there was quite a few children and youth at that time who were receiving medical care or other supports through the Children's Hospital. And it was the earlier stages of Jordan's Principle, and a lot of families who were there had needs, and they weren't always sure how to go about applying for Jordan's Principle. Who do they contact? How do they ask the questions that they need to? And also making those connections back to their home communities if they were from a First Nation, or even just located anywhere outside of Winnipeg. How do they connect back to the resources that would be available in their area? We had started conversations with the higher ups at the Children's Hospital at that time. And we'd also identified too that there's a lot of these same sorts of needs for children who were receiving outpatient and other kind of clinical supports at the Specialized Services for Children and Youth Center, which essentially is a hub for disability type services here in Winnipeg as well. A lot of the community programs that used to be located in various areas across Winnipeg had amalgamated and are servicing children out of one site now. So through discussions and also with Indigenous services, we were able to secure some funding to start a Jordan's Principle program that first had a focus on navigating. So helping families navigate the services, knowing what's available and how to reach those resources that they needed. And so in 2019, things were put in place to get these positions going. And shortly thereafter, the pandemic hit. It threw things, in a totally different direction. A lot of people, as you would be aware and know too, had to take on different roles and look at the way that services are delivered in a very different way, especially through the healthcare systems. So unfortunately, we weren't able to get positions into the facilities quite at that time. But shortly after, in about later in 2020, we did have one navigator role that started at the Sky Center. It was quite limited because a lot of those services were kind of shut down to the public. It was just for appointments, but the coordinator or the navigator role that we did have there worked very closely with the clinical staff at the Sky Center to at least help to consult and provide some information on how to support First Nations families, whether they're there for whether they're for care, to help with the meetings, and to also connect to their community Jordan's Principle programs to ensure that services would continue once they go home. In 2021, we had a full-time position there at the Sky Center, and almost going on 2 years now, we now have a full-time role as well, working with the Children's Hospital. Maybe I'll kind of wrap up quickly here too, so I could give Dr. Lane a chance to talk about the partnership that the Children's Hospital also has for the North. But just to kind of finish up with the coordinator role that we have at Children's, we're able to bring on a wonderful team member who already had experience working with the hospital through the Indigenous health services. So she was very familiar with team members, the policies, procedures, everything, how these hospitals worked and how to navigate the supports there. So it was pretty seamless to have her move into this role and support families directly. Over the past year and a half, we've expanded further so that Pearl doesn't just work within the Children's Hospital and those units, but also supports the adjoining Women's Hospital. There's times when expectant moms have babies who sometimes have medical needs, whether they're anticipated or not, and required longer hospital stays. Sometimes might require medical supplies, equipment, different prescriptions that the child might not otherwise have coverage for or eligible for. Those kind of requests can come through Jordan's Principle, or sometimes just babies that come early, and supporting families while they might have to stay here for an extended period of time, and need some resources for them as well. We also support the pediatric area of Cancer Care Manitoba, which is also joined at the Health Science Center where Children's Hospital is located, and support the pediatric palliative care unit as well, for children who are sadly in their last stages of life as well, providing wraparound services for them. There are times too when we get requests from other hospitals within Winnipeg, outside of Winnipeg, because we have this specialized focus on supporting children through Jordan's Principle in the medical setting. So our team member is often reached out to see how we can help. So maybe I'll pass it on to Dr. Lane, and she can talk about the partnership for those other Jordan's Principle supports.
Hi, thanks, Joni. And we're wanting to leave time at the end, obviously, for questions, but also to talk a little bit about some of the hiccups along the way and the challenges, because that's, I think, part of the big informative piece. So also starting in 2018 for our department here at Children's Hospital, we were approached by FINIB for the Indigenous Services, the Jordan's principal lead people at FINIB, to ask us to put more direct service into the communities in Manitoba. And so that is service directly on reserve for children. This already existed to a certain extent in Manitoba and had been going for really decades, with a service to some of the communities. I think it totals something like 15 of the 63 communities were getting services through a project administered by something called OHS or Ongomasun. Totally aware of not trying to kill everybody with all of the abbreviations, because the bottom line is sometimes we ourselves have trouble saying the whole words because they're complicated. But there was already a system in place where we had pediatricians visiting 15 of the 63 communities in Manitoba, um, uh, administered through the University of Manitoba. So ISC asked us to expand the number of communities that we were going to provide direct service. So we teamed up actually with the Department of Clinical Health Psychology here, who was also looking at trying to provide some direct service, so that we now have a program that sends pediatricians and clinical health psychologists to another 14 communities in Manitoba. Um, so just the evolution of that, I think, was interesting in that even though we were approached directly by ISC to do it, and then we put in an application, a proposal to do it, lo and behold, to our surprise, it wasn't approved, which I think took us back a bit, given that we thought we were doing what we were asked by them to do. But ultimately, what it was they said, no, we don't want you to administer it and do it directly. We want you to partner with an indigenous organization and have them be the administrators, and really be a partnership between the departments and um, um, the university and um, the organization. So we partnered with the group called MKO, which has a long name that even the people who work at MKO struggle with. So I'm not going to. It's three Cree words, and Kiwatenok, I have to do it now. Kiwatenok, Ininu, Minnow. No, that's not even the right one. Sorry. Uh, there's a lot of words. Um, anyway, we partnered with MKO, and they are the sister organization to Southern Chiefs Organization, SCO, that Joni's been talking about. And they basically are the political advocacy group for the First Nations communities in Northern Manitoba. And with them, we now send pediatricians on 3 trips a year per community. So of the 14 communities that we would go to, we send people for 3 trips a year to do in-community visits, and we send a clinical health psychologist once a year to each community. So the pediatricians, when we first started going, and a large part of the focus, you can imagine, if we're going 3 times a year, we're not there to see the the acute care right in the moment, because 3 times a year wouldn't work very well. But we are there to see any of the chronic healthcare needs for children. We we do have a particular emphasis on looking trying to meet the needs of the kids who have developmental needs. um, you know Really, I think coming down to the heart of the genesis of Jordan's principle and the initial real focus on developmental children with developmental needs, but really we'll see kids with any healthcare needs that are chronic, and if we happen to be there, of course we manage the acute needs while we're there, but it's obviously not the overall setup to work. The clinical health psychologists are there to do assessments for kids with developmental needs. The kids where there's, does this child have autism question? Are there psychoeducational needs, learning disabilities, whatnot? They'll do assessments for it. They're not there to provide direct psychology therapy because, again, once a year isn't going to work for that. But that's what we do. Overall, it, I think, has been um, largely a success, and there's certainly been some hiccups. I will say, when we had to start, we had to start with saying, well, which communities are we going to serve? And how do we decide that? So that there was a process around that. We deliberately chose the communities that were not already getting service. That's like a fairly fundamental, basic concept. But then really had to look at, what is the child population in each community, and where were we going to be the most likely to be the most benefit. And then some of it came down to really just very basic like logistic things, like, is there room in the health center to, if a pediatrician shows up, where we can actually see kids? Is there a space somewhere where the psychologist can see kids? Because without those things in place, we really couldn't be very effective. So some of those very basic things had to be in place. And then ultimately also we had to be invited in by the community. So we are not going to offer or arrive in any community without the invitation of the chief and council and the larger community. So all of these factors have influenced which communities we have gone into, and which ones that we haven't offered service to as yet. Um, I would say overall, we're really viewing it as a success. As I say, there are some hiccups. There's certainly been a learning curve with respect to the administration of it. Um, some of the things that I think that a person, at the beginning, that there are all the unanticipated issues that come up. One of the basic ones is so these kids, they were not getting direct pediatric service in their community prior, and don't when there's not a pediatrician coming. But it's not like a child sits there with asthma not getting service. It's like you can only get your asthma treated for 3 times a year. Like, that doesn't work, right? So the trying to figure out the who sees which kids when, and which kids get referred to the hub community of mainly Thompson there. For some kids, the hub community it would not be Thompson, but mainly who gets referred to the hub community for pediatric care versus, does the pediatrician who goes 3 times a year get contacted? All of these things, I would say, are still really getting worked out, and it's challenging. So these are some of the unanticipated needs. The other thing I'll say is we do not have a provincial electronic medical record in Manitoba, and that's a real disability. And even the new provincial electronic medical record that is theoretically going to be coming our way in the next few years is apparently not going to include the federal nursing stations. So it still leaves a real disconnect in care. I just wanted to mention as well, in terms of representing things today, Joni and I've focused on the things that the Southern Chiefs has done, and this particular project that Department of Pediatrics has been involved in. But there are many different partnerships that are going on in Manitoba through Jordan's Principle funded services. And so just to branch out, because I don't want to leave things out there. One of the organizations here has a very well developed service where they are sending therapists, so namely physiotherapists, occupational therapists, and speech and language therapists to with the intention of being in all 63 First Nations communities in Manitoba, and with visiting therapists who go really regularly and deliver therapy in the communities. There's another organization who offers nursing consultation, advanced nursing consultation services, and various services. One of our organizations that's really focused particularly on people with developmental ability challenges to increase service there. And there's another service through our mental health, our main pediatric mental health service in the province, to deliver a virtual psychiatric service to the First Nations communities. So there's a broad network, and I would say we are all very pleased to have all of these different services in place, but even within that creates its own challenges of figuring out who's doing what where, and those kinds of things. Joni, I'm going to turn it back to you in terms of.
Sure, maybe I'll just kind of wrap it up. So if there's any questions, but as Dr. Lane had mentioned, it's been great that there's been so many connections and partnerships that have been made over the past few years with the implementation of Jordan's Principle and willingness, for the federal government to allow us to be creative and address some of these gaps. But a gap that still does continue is that children and youth age out of Jordan's Principle. And here in Manitoba, our age of majority is 18, and that it's at that time that these services end. And especially for those who live on reserve, these gaps often reappear. And there's often, again, lack of services or shortage of services, or long distances to receive these services when they have to leave their community. So there's always advocacy taking place, through organizations such as my own, through Southern Chiefs, through the North, across Canada as a whole, for Jordan's Principle to get rid of this age. Certainly when it comes to disabilities, when it comes to medical conditions that children and youth may have, it doesn't just magically disappear once they turn 18 and, they don't need these supports anymore. So we really hope that there comes a day sooner than later where we can extend these services further past that age and continue to address the needs of First Nations people here in Manitoba. So maybe I'll wrap it up there. And if anybody has any questions for either myself or Dr. Lane. Maybe Sarah?
Yeah, thanks so much, Dr. Lane and Joni. And thanks, Dr. Lane, for kind of briefly highlighting there some of the Jordan's Principle work that Saint Amant engages in, which is the organization I work for. I don't directly oversee that program, but I do hear from them kind of the real benefit and value in being present in community to build relationships while also building capacity. And so that's been a real positive outcome. Joni, thank you for mentioning that challenge around services ending when children turn 18. We certainly have seen the impact that can have. I have two questions. So one question, and I apologize if I missed it, but Joni, when you were talking about system navigation within Jordan's Principle, um, I can appreciate the need for families to have that support. And I think as a service provider for children, we as well struggle to sometimes understand, who to call or how to access certain parts of the Jordan's Principle system. Um, and just curious if there was any work there or any where the best place is for organizations to go to better understand Jordan's Principle. And then my second question is, if we find ourselves facing situations where we have concerns about the delivery of Jordan's Principle or that concept of services that all children are entitled to being delivered without delay, what is the best way to kind of escalate those concerns?
Thanks, Sarah. And those are great questions, and ones that we get off, especially the first part about navigating the services, because it can be complex. Because we have so many different Jordan's Principle providers here across Manitoba. And there's also the misconception sometimes of, if somebody comes to our program, um, they think that we are Jordan's Principle, that we all know what each other are doing, that we all are one and the same, when it could be very different. Like what one First Nation how they deliver their services might be different than the next, might be different than tribal council, might be different from the PTO offices, or indigenous services even. So it can be challenging. However, we all work together very closely, and we do a lot of referrals back and forth to each other as well. Like here at Southern Chiefs, we have a focus on the areas of the medical, working with the provincial medical systems. We also work very closely and have coordinators embedded in the provincial education systems here in the South. Um, those don't necessarily have the same in the North, though. So sometimes, even there, it's a little bit more challenging to navigate. And our coordinators in the health areas, we also support children who might be from the North or living in the North. We also support ones who live in northwestern Ontario, sometimes Nunavut, sometimes Saskatchewan. Um, so there's not really like a one-stop shop of, who can you go to find out what you need. But we do try to share as much information ourselves and the other Jordan's Principle providers, through social media, through our community or our program sites, etc. Indigenous services is still probably like the main hub here in Manitoba that people can put in a request to. And then they might be forwarded to our other organizations to actually deliver the services. So we're working on a navigation map, though, if that helps. We do have a Jordan's Principle technical advisory group, which is all parties meeting together once a month. Not everyone's always at that table, but we are going to be working on trying to find a service map to have all of our contact information. So we hope to get that completed soon and then have somebody who's actually going to be dedicated to kind of be that knowledge holder of and keeping that updated so everybody can kind of go to that one place to find out who they need to go to for what, because it's not always straightforward. When it comes to concerns regarding delivery, I guess again, that would kind of depend. If it is, the first place would be like if there's a Jordan's Principle provider, going to that provider. If it's through a First Nations, there's always ways to escalate that. If whether it's through the management first of the of the program itself. People could even go as far as like talking to chief and council if they feel a child's needs aren't being met. There's also going through indigenous services. So as a whole, concerns can go there. If it is indigenous services themselves, though, that don't seem to be fulfilling the request of a child, there's appeals mechanisms that can take place, that can go to headquarters in Ottawa for an appeal. There's also a mechanism above that, even if it gets denied at the national level, there is an appeals board that is independent of indigenous services that families can go to as well. And when they have the support of a Jordan's Principal Coordinator or Navigator, or somebody back within their own program, they have a much better chance, which we've heard nationally, that they have a much better chance of getting their decision overturned if they have the support of somebody who knows the system. So instead of having families just have to navigate that on their own or try to advocate on their own, it's always good to have somebody who actually works with Jordan's Principal. Thanks.
Thanks so much, Joni.
No problem. If I get this wrong, I apologize. Margo Lane?
Yes, hi. It's almost like Dr. Margo Lane, but a little different.
It is.
Thank you for your wonderful presentation. My question is actually for Dr. Lane and yourself, Joni, if you want to comment, but I couldn't help but notice that in that first map, you showed at least, correct me if I'm wrong, 63 independent, separate communities in the whole province. And you mentioned that there's only about, is it 15 that get visits? So I'm wondering what is happening with the balance and the rest of those communities, and is there a plan to expand the services so that eventually all communities get those pediatric visits, or
Yeah, no, that's next question. So through the services that were in place before Jordan's principal came along, in fact, before Jordan was even born, the University of Manitoba had pediatric services going into 15 communities. And then with this, we've been able to add another 13 to 14 communities. I say that because one community, it's just a double counting on something. But ultimately, we have pediatricians going into 28 communities, and then a psychologist into the communities that our program, like our MKO partnership program, sends the psychologist. The psychologist doesn't go into the pre-existing community. So we have managed to get pediatricians into 28 communities. Many of the communities, particularly in the south, they actually don't necessarily have a full nursing station on in the community, because they tend to be road access. Often there's an adjacent settler community next to it. It's really much more the northern communities that are remote and less accessible. So for sure, we do not have full service across the board, and that is a goal to move to. But it is, it's not quite as bad as it sounds in that many of the southern communities will have a town right next door.
yeah, no, I
Right.
understand that, and that is reassuring to hear. So
Yeah.
thank you for that.
Yeah.
We have had discussions though, and actually just as a little bit of extra info, Dr. Lane and I had worked together through this project. I was working for MKO, working for their health transformation area, which is now taken over the services. So we had this experience working together, and we've had discussions at that time, and even more current, about trying to get, working at some stage to get some pediatric and clinical psychology into the southern communities, even if it's looking at more of those communities that are remote as well, flying communities. But Jordan's principle kind of happens in phases. It's always year by year funding, which is a bit of a challenge because you can never get multi-year funding and larger projects, but it is something that we've discussed too.
And I think this points to the issue where, you know, we can do things, but in order to really accomplish things, you really need that overall leadership vision at the higher level in order to accomplish things, right? So, you know, it is a priority that I see within Manitoba around you know, really a focus on increasing the number of Indigenous healthcare providers that we have. So focus on medical school enrollment, making sure that we have better representation of Indigenous people coming into medical school. I will say it is in the Department of Pediatrics for sure. It is a focus of trying to uh, increase the number of Indigenous providers we would have on our pediatrics faculty. But failing that, because you can't just go out and knit a pediatrician, making sure that even the non-Indigenous people that we have joining, first of all, trying to make sure that anti-racism training is in place for people and those kind of fundamental threads, but also when we're going about recruiting. So I'm about to go into a recruitment process for members of my group, which we call Social Northern and Ambulatory Pediatrics, really making sure that the people who we would look to hire are very committed to participating in traveling, right? Because it takes a commitment, I will say, on the part of the providers to make these trips.
Thank you so much, Dr. Lane and Joni, for sharing your successes and amazing partnership with us. Thanks for the wonderful presentation. We're going to be swept away to the main room, followed by a break. So please come back here at 2 p.m. Thank you very much.